Welcome, everybody, to a new episode of Wellness Decoded. My name is Alan Gonzalez. I'm your co-host with
Darlene Gonzalez.
And we're the founders of Optimum Health of Utah. We are a functional integrative medicine practice and advanced aesthetics clinic here in American Fork, Utah. We have an office here in American Fork and one in Helper Price area. That's Utah as well. And today we really wanted to dive in a little bit deeper, more specifically into the consultation around hormones and what Darlene talks about with her patients when she sees them for the first time. And she'll probably talk a little bit about, kind of getting to know them and different things. So we've got quite a few little steps along the way that we've identified that we think would be very good information for you guys. And so we wanted to start first with when you first meet the patient and your introduction, you're getting to know them. What are some of the things that you do with them and talk about there?
I just kind of want to know what your primary health concerns are. What is it that you're wanting out of this visit? What is the reason for this consultation? I really like to figure out who you are, a little bit of your background,
lifestyle,
what your likes are, etc.
Yeah. Okay. And then you kind of go right into the second step, and that's really diving into the patient's history.
Right.
So history.
I want to review your medical history, include your past diagnoses, surgeries, medications that you're on, any type of supplements that you're on, nutrients. It doesn't matter what it is. It could be just as simple as your protein. What are you taking? Any previous experiences with hormone therapy is really important for me to know, and any type of functional medicine that you've actually had in the past. I want to know your family's medical history. Anytime you've ever had any issues with a hormone, so that includes thyroid, parathyroid, cortisol, any type of autoimmune conditions, etc.
Okay. And then you're kind of diving into things like symptoms and lifestyle assessment things.
Mm-hmm. Yeah, exactly. So it's really important for me to understand what your lifestyle's like. Food that you eat on a daily basis, a day in the life of you. What is it? What do you eat for breakfast, lunch, dinner? What supplements are you taking that day? What exercise are you getting that day? Stressors, how hard is your job? How hard is your school? What is it? Are you having issues? Is there relationship issues? Any of that can contribute to increased levels of cortisol and imbalances of hormones as well. So I do like to talk about some of those things. Are you in therapy, etc.?
And I know one of the big ones that you dive into is a lot of like the stress level management, sleep quality, things like that.
Yeah, because sleep is one of the things that we need. If we don't have sleep, we literally can't function. You cannot recover from the day before if your sleep is below par level, or if you're not getting into REM sleep, etc.
Right. And once you've done that, now you kind of dive into the next one, and that's kind of more of that hormone therapy discussion.
Right. So when we are talking about hormones, I want you to understand the negatives and the positives. But there's so much misinformation out there about the negatives that I really want you to know what that misinformation is. What is a hormone in your body? First of all, hormones are like estrogen, progesterone, testosterone, thyroid, cortisol. What does it do for you? How does it help your body? First and foremost is your improved energy and mood, but it also helps with the cognitive, the way you think, the way you process thoughts, helps with libido, helps with the muscle strength, weight management support, reduction in like all of those menopausal and andropause symptoms. But sleep is a great benefit from hormones when you're imbalanced or deficient in progesterone. This includes you guys as well. It's not just women. So I feel like I'm one of those people out there that checks progesterone on every single man and woman and child. Child that's already gone through puberty. But it's interesting because I don't see that very often anywhere else. If you look into a few studies, really quick, I'm just going to mention this. And these studies are, maybe we can post them in the bio later.
Yep.
But sometimes, in these particular studies, sometimes they have seen just as much as women, the men who have depression, anxiety, and stress are deficient in progesterone. That would be kind of
And they don't
interesting.
need as much, but
Oh, yeah.
there is a need for some.
There is an absolute need for some, yes.
And a lot of, and because I know I've gone to my practitioner in the past, and they were like, oh no, you don't need it at all. But they don't understand, unfortunately, they don't understand really how hormones work.
But then his was extremely deficient, and he was having trouble sleeping. And so we noticed when he got put on the progesterone that he slept like a baby. So
Definitely much help.
There's also this thing that I like everyone to understand is that these type of hormones are not just oral. So you could do the pills, you could do the creams, you can do the patches, you can do the troches. You can also do pellets, which I don't really agree with because pellets are hard to regulate. But there's so many different options. Plus there's bioidentical versus synthetic. The bioidentical is the way we want to go. Synthetic are not so beneficial for the body.
Why do you go with one and not the other, or feel like one bioidentical is more important?
Bioidentical is made specific to the chemical structure in your body, whereas the synthetic, not so much. Sometimes the medication inside is not natural. It's an unnatural chemical. And so even though it can be more beneficial than not taking hormones at all, sometimes it's not worth it if it's causing problems, and it's important to switch to bioidentical at that point.
Yeah, is there less reaction or adverse reactions when it's bioidentical?
When it's something that's similar to the body, what the body's already making, then there's way less reaction.
Yeah, for sure. And then as you go into the next step, and that was the one thing I wanted to mention to everybody. That's the reason why we utilize this term integrative medicine. East meets West. It's the best of both worlds.
Yeah, we do say that a lot just because it's important for everyone to know that we don't what's that word? We don't compromise. But the other word that I was thinking, it was kind of a joke, and now I can't even think of it. Darn it. If I think of it, I'll let you know.
Yeah. And so we take the next step, obviously, you explain, is taking that functional medicine approach. So talk to us about, what is a functional medicine? What are the principles around functional medicine?
Well, I mean, honestly, first and foremost is it's more natural. So you can take and use as prescriptions every day of the week, but sometimes it's best to start with functional, natural supplements, and utilize those first to see if that helps with your cholesterol or your blood pressure, your blood sugar, because a lot of the medications out there that are prescription based, that is covered by your insurance. So that's a positive, right? But the negatives are gut issues, like with metformin, for instance, and you don't see that with berberine.
Right.
So,
and so we're talking about treating the root cause, not just the symptoms.
And that's true.
Right. Because we're kind of getting into this, like I said, the whole integrative medicine, East meets West. And a lot of people are kind of think this is voodoo medicine. What do you say to that?
I say that if it's a voodoo, then, what about all your ancestors that used this for years and years? I mean, this is how they lived and how they survived. I still believe in Western because they didn't have immediate surgery for gallbladder removal, cardiac surgery to, cardiac, a coronary artery bypass graft. That's like invasive surgery, invasive. And I love it. I think it's amazing. It saved my dad's life.
That we have that. Yeah. And there is studies around functional medicine. Natural.
You can find them everywhere, all over the place,
we'll add a couple.
There's more and more people who are going towards natural like this. So, but it really does focus on that personalized, because I will make you a sheet that basically it tells you exactly what you need to do. 1, 2, 3, 4, 5, 6, 7, underlined and bolded on the things that I suggest that you do on a daily basis. And if you follow them, I can guarantee that it's going to help you. I can't promise you that it's going to cure you, but it definitely will help you.
Right. And then part of this also is the labs that you run, the level of, that you run versus what a standard practitioner may run. Talk a little bit about that.
Specific to, say, your yearly physical, you're going to have a CBC, a CMP, and a lipid panel. Well, here we do all those, but we also do a thyroid function test, fully adrenal stress profile, inflammatory markers, nutrient markers like B12, iron, ferritin, insulin resistance. We want to see where you are, hemoglobin A1C. We want to see if you've got any, if your FSH and LH are where they need to be, because LH being higher than the FSH sometimes can indicate PCOS. I mean, the panel that we do is so comprehensive and huge that you would just be extremely happy, sometimes overwhelmed by the data. Yeah.
A lot of information.
But it's nice because I do break it down for you, and I do make notes for you on the actual lab paper itself. But the summary that I do give you is very understandable.
Yeah.
Because you want to make sure that I want to make sure that you guys don't go home and say, "What did she say?"
Right.
So she has, you have absolutely everything.
Yeah, she puts together a really nice review and puts it in a way that's very understandable, and that people love it. So that and so they have that for their record, and then we put that in their chart as well,
Mm-hmm.
and so we have all of that, and so. Yeah, that's definitely, and it's over 50 biomarkers,
Mm-hmm.
and you're not going to get that anywhere with a lot of providers that don't do this integrated functional side of things. And so it's important to look at all these other aspects of your health that are affecting how you're feeling.
Right. Exactly.
So okay, and then once she's done all that, she's done the testing, you've come back in. She goes over the treatment plan and starts to explain the results.
Which is basically what we just talked about. I write the summary for you. I write on your lab's notes so that you know what each one of them mean. Even the good. We take the good with the bad and the bad with the good, because we want you to understand that this is liver's functioning well, spleen's functioning well, heart's functioning well. You might have a little bit of an issue with your kidneys or whatever. So we will explain all of that to you in that treatment plan overview. I also like to make sure that you understand that a lot of this is food related. Not that I'm saying what you eat is bad, but there's things that can help with your labs based on the type of foods you eat. So some people are shocked when I tell them you need to eat more fat, and good fat, HDL. So fish oil, salmon and almonds and extra virgin olive oil. And you'll notice that you're feeling better, more energetic, and losing weight.
Right.
Yeah.
And then part of some of this overview is, like you said, the foods and the dietary changes, but there's also supplements that you may put that are the natural side of things, right?
Yeah, of course. Yeah. So in that summary, we'll have written out what supplements are important for which problem we have.
Right.
So, yeah.
And we carry those here. We work with a really great company, Orthomolecular, and we've been very happy with the results.
Very happy.
Patients love it.
Yep.
People that have gotten regulated still come back to us for these supplements, years afterwards.
Mm-hmm.
And so it's definitely been a big plus for our patients.
Yeah, and we have tried other supplements, and we are sticking to this one. It's absolutely amazing.
Absolutely. So. And then I think the last part you have here is just that follow-up process. So what does that look like?
Yeah, so
they come in the first time, and then
you're going to come back in if it's the very first time, depending on what the biggest issue is. So if it's just hormones that we're treating, then you'll come back in 3 months just to recheck those and make sure that everything's good. It is mandatory to come in every 6 months to recheck everything on the full functional panel, because that is going to change. Your body does not stay the same. It changes from time to time. So 6 months is the minimum, the max, mm-hmm. But we prefer that you come in at the 3 month mark if you're brand new. And then, like, I had a patient today that I have her coming in 6 weeks because of a issue with her kidney function. And we want to make sure that that's where it needs to be, that it wasn't just a fluke that she had a GFR of, say, 50, whatever. But if so, and it's still low, then I'll have to refer her to nephrology. So it's really important for me to make sure that we know what's going on with your labs and that you come back and you follow that protocol.
Right.
If you don't follow that protocol and you wait 6 months to come in and you still have a kidney issue, that could be a problem.
And so the one thing that is super important for people to realize is that it's not cookie cutter. It's very unique and specific to the patient.
Right.
What you put together, what you say, even the follow-up could be is unique to them. So that's really important. So
yeah.
And then the next one is addressing concerns and questions that they may have.
Yeah, so we'll go over all of the questions and concerns you have at the consultation, but then again at the review. So if I didn't answer your questions at the review, then we're going to continue to have discussion. Meaning, I know that this can be scary if we have changed a lot or we've put a lot in that protocol for you. And so that means that you have a texting line. You can text us on at any time. Appointments are very affordable, so you can come in and have an appointment with me if you'd rather spend 30 minutes sitting down talking. But it is really important for you to follow that protocol and know what we're talking about. So if you have questions and you don't ask them, then that can be problematic because you won't be able to feel better unless you really know what we're doing and what you're doing and we're explaining it clearly.
Right.
So,
and then lastly is just, they've come in, they've done their labs, you've done the review, they've got their protocols, and now the patient has to go off and do what you told them to do.
Yeah, I just want you to be committed to your health. I want you to realize that this is a collaboration between me and you. And so once you realize that and you're no longer shy about texting me, it's going to be important for us to continue that relationship. I have people that maybe, for 5 months and they'll text me like an interesting question because something may have changed. I just had a hot flash, which I haven't had for 5 months. How is that and why is that? So a lot of times we'll get labs if I see something like that right close to their 6-month blood draw. So keeping in touch with me is super important. Let me know when you have side effects or issues is super important. I'm telling you, it's definitely hard for people to believe that we are here and available for you at all times.
Yeah, that's super important, and a lot of people have left reviews, and people have just commented that you have just changed their life, saved their life, and that's why you do what you do.
Yeah, I love it. It's just my heart. I just love it so much. I had a patient come in today, and it was her 6-month blood draw review, and she told me, she's been with me for years, but she told me she has never felt better in her life. She thought she was actually near death about 2 years ago. She didn't expect to live anymore because she had a particular condition. And today she's saying, I can do anything. I can literally hang out with my kids, my grandkids, run, jump, play, everything. And she's around 55, 60.
That's great.
So of course I'm not going to give you her exact age because of HIPAA, but it's pretty amazing when I see that change, and it does put a tear in my eye because that's what I want. Yeah. That's what I want for you.
So that's that. We really wanted to share today a little insight into the process, a little bit more in depth. And so hopefully you got a little bit of information. If you've been contemplating getting services like what we provide, hopefully this is giving you a little insight and almost kind of like a little bit of a consultation of what we do.
Yeah.
A little pre-consultation, if you want to call it that. So. And that's what we're here for. We really want to make sure we're helping all of our patients. Any last minute or last?
I think that notes? Teddy just wants to say hi because he is our mascot. So everybody say hi to Teddy.
That's Teddy. And so, well, we'll go ahead and leave you here at this point, and please give us a thumbs up if you like the information. Please share with your friends and family and colleagues. Somebody may have been looking for things like this, and please consider subscribing. We want this channel to be very, very informative for people and really provide a service, and that's what we're really here for. We'll continue doing it as long as you guys continue to support us, and we'll continue to bring great content for you. So
yes, absolutely.
Okay, well, then we will see you on the next one Love ya.
Love ya. Bye.
Bye.